Hello everybody, welcome back. This week we are going to talk about drug exam number 8. And these are medications that we give during pregnancy emergencies as well as hypertensive emergencies. And we have several medications that we're going to talk about today, but these are not medications that we give very often. When dealing with hypertension, sometimes the care needs to be a little more nuanced than what we are used to. You've heard me talk about before how a lot of the things that we carry on the ambulance as far as treatments are hammers. They hit strong, they hit hard, they hit fast. And in a lot of situations in our role in healthcare, that's what we need. But sometimes the treatments need to be a little bit more nuanced and measured. So as we talk through these, understand that these are not medications that we give very often for these situations, and remember to always follow your local protocols. So the first medication we're going to talk about today is magnesium sulfate. We've talked about magnesium sulfate in the past, but today we're going to talk about it specifically for treating seizures after the onset of eclampsia. Remember, the difference between preeclampsia and eclampsia is the onset of seizures. A lot of women become preeclamptic. What do we see when we see women that are preeclamptic? We see hypertension. We see a lot of peripheral swelling. We see fluid retention as well. And we see dizziness. We see headaches. And all those things are strong indicators of preeclampsia. When preeclampsia becomes life-threatening is when it progresses into seizures. So with mag sulfate, our dose is 4 grams IV given over 10 to 20 minutes in an IV drip. It is something that is not given to stop seizures. I don't want you to misunderstand when I say this, is that we don't give mag sulfate to stop a patient that is having a seizure from eclampsia. We don't give it to stop the seizure. It will not stop the seizure. It will lower the blood pressure, which will reduce the risk of subsequent seizures. So that's an important distinction to make. It does not stop seizures. It prevents further seizures, and it does that by lowering blood pressure. Now, it is a very powerful vasodilator, so we have to give it over a length of time. You can be presented with hypotension if given too fast. So when we say 10 to 20 minutes, that's not just something that's written in the protocol book. We need to give it over 10 to 20 minutes because it can cause too much drop in blood pressure. It also can be a central nervous system depressant. It can also cause respiratory depression. So we have to give it in a measured amount, and that's why we do it via IV drip. The next medication we're going to talk about is Procardia. Procardia is a calcium channel blocker that is given to treat hypertension in preeclampsia. Again, this is before the onset of seizures, and this is given an oral medication of 10 milligrams, and it's given for women who are preeclamptic and they're having issues with hypertension. And it works by slowing down the calcium going in and out of the cells at the cardiac level or cardiac cell level. So it is a calcium channel blocker. Now remember, there's a I shouldn't say easy, but there's a good way to remember what the possible side effects are of a medication. And that is by knowing what the medication does. If a medication is known to lower blood pressure, obviously one of the side effects can be giving too much of the medication, causing hypotension. So you can look at what a medication does and somewhat predict what problems it might cause. And remember, this is given 10 milligrams, given orally, and it's usually a daily medication that's given for them to keep their blood pressure down during the pregnancy. All right, oxytocin is the next medication we're going to talk about. And it is an endogenous hormone. And remember what hormones are. Hormones are messages. They're a message from one part of the body to another part of the body. And in this situation, it is a message to cause uterine contraction. Now, if you've had a child before, or your spouse or significant others had a child, you might have heard the term, they started them on PIT. That is the other name for oxytocin, is Pitocin. Now, in the hospital setting, they will use oxytocin or Pitocin to initiate or progress delivery by causing uterine contractions, and that will speed along the delivery. We do not give it for that. We would never want to do anything to quicken a delivery pre-hospital. If anything, we want to delay the delivery so we can get them to the hospital. So the use for this medication pre-hospital and in the hospital are two different things, where our jobs are different. So we use the medication differently. When we are going to use oxytocin for a patient, it is for postpartum hemorrhage. We would never give Pitocin or oxytocin while the baby is still in utero, because that's going to have bad effects for the baby. The baby's going to be born quicker. It could be a violent birth. It could bruise the baby. It could damage the mother. There's a lot of things with that. So this medication is given IM usually, and it's given in 10 units. And we'll give that IM, and that is to reduce postpartum hemorrhage. But I must urge you, remember that you are a paramedic, but you are an EMT first. There are things you can do that don't involve medications to help with postpartum hemorrhage, and that is fundal massage. The moms don't like it. It's very painful, but fundal massage can slow postpartum hemorrhage significantly. So don't forget those basic things. It takes not very long at all to rub the fundal area. It takes time to get the medication out. So while you are getting the medication ready, you can also have your partner be doing fundal massage. And just a quick note, the onset of oxytocin is 3 to 5 minutes, so it works pretty quickly. Hydralazine is the next medication we're going to talk about, and it is given for hypertension. It's given in 5 milligrams IV. The other name for hydralazine is apresoline, and it is an antihypertensive. It causes vasodilation, and it can be given for patients that are hypertensive. And now when I say hypertensive, I don't mean 140 over 90. We're talking about diastolic numbers above 100, 110. The patients that are acute risk for stroke are the patients that we're talking about in treating of hypertension. Hypertension needs to be handled carefully. I've talked to you about it in class, and I'm going to talk about it again here now. This is not something that is ideally suited for EMS. EMS, we carry hammers. This is more nuanced. This needs to be monitored closely over hours, not given rapid IV push. So we have to be very careful when treating hypertension pre-hospital, because we don't want to go too far. So we want to bring that pressure down slowly, not drop it dramatically, because that can cause a whole nother line of problems. The next medication we're going to talk about is NitroPress. The other name for NitroPress is nitroprusside. Okay, it is another antihypertensive vasodilator. This dose you would want to contact medical control and follow your local protocols. But it is another medication that is given for hypertension. Needs to be given in a nuanced manner, again, like the previous medication. And it is strictly contraindicated for patients with known heart failure because we can just take them too far. We could take a patient that is hypertensive and make them very hypotensive very quickly, and we're causing more problems than we're fixing at that point. So that's the medications that we are going to talk about today. Remember, these are medications, this whole list of medications are not something we give very often pre-hospital. Some agencies don't even carry any of these medications. So as always, follow your local protocols, and we will see you next time.